Hi again. I'm going to be talking about the treatment and procedures that are affiliated with necrotizing fasciitis. Just to kind of step back a little bit, when we discuss the early signs and symptoms and also the advanced symptomology, one thing to remember with the advanced symptomology is that there are some very critical symptoms at the end. There is an increase in confusion and weakness, and at times delirium. The infected area may split open and release large amounts of cloudy reddish brown fluid. I talked about the blisters, the bullae, and these are bloody yellowish fluid comes from there, and the area is black. Necrotic lesions appear, and the skin breaks open. And as I talked about before, is that the pain subsides because the nerves are destroyed and there's a lack of sensation. And then we have the anorexia, the decreased blood pressure, increase in heart rate. We've got rapid breathing going on, and eventually it can lead to the patient's vital organs, such as the kidney and the liver, and the person can shut down and go into toxic shock syndrome. So unfortunately, death is imminent at that point. So treatment needs to be very hard and fast, and early detection is a must. So usually what they try to do first is to do the surgical debridement. And basically that's just removing the dead and damaged infected tissue. And timing is really important because the surgeon, of course, wants to make sure that the tissues that are involved are removed. And that means that what the surgeon's trying to do is control the infection and even the spread to vital organs. Because remember, I was saying that those advanced symptoms, the critical conditions, the organs can be involved. And that's when you have the body shutting down, the organs shutting down, and going into the toxic shock syndrome. And so surgical debridement is very, very important. And unfortunately, it's not always involving just the tissues that are affected. Sometimes it could be limbs, and it could be led to amputations. And so when there is a surgical debridement, it's not just one time, it could be several times that area has to be taken care of and the dead tissue to be removed. And so the wounds are to be left open. It's usually a wet to dry dressing. And when that is healed and when the debridement is no longer required, the other treatment would be skin grafts or plastic surgery. And then we can close the wounds, basically. But if there is the necrotic tissue, it needs to be removed ASAP. The other intervention that's done with the treatment is antibiotic therapy. And the antibiotic therapy is very important because it's going to control the infection and it's going to prevent any sepsis occurring. So we don't want any further spread of infection. The number one antibiotic recommended for this is vancomycin, and it's a gram-negative bacteria, so it's going to focus on those bacteria. Vancomycin also prohibits or inhibits the toxin production. And so antibiotic therapy is of utmost. Surgical debridement is of utmost importance. And there is two other treatments that can be done, which there haven't been a lot of research on this and the efficacy of these two other treatments, but one is the hyperbaric oxygen therapy. And what that does is it decreases the infection, and it also decreases that exotoxin production, or those toxins that are produced. Not proven adequately, but they're still using that as a resource. And the other one is the immunoglobulin therapy. And immunoglobulins are used in the immune system to fight foreign matters or foreign infections. And so there is the administration of the IV immune globulin therapy. Um, but again, is not FDA approved at this time. And basically, the theory is that the IV immunoglobulin therapy, the they bind to the exotoxins, um, disintegrate them, destroy them, and therefore limit the dangers of further infection.